Some of the symptoms of renal coloboma syndrome include the renal insufficiency. This is the kidneys working nowhere near their peak efficiency, such that the volumes of extra fluid are not properly eliminated, and the waste, toxic waste that piles up from cellular metabolism keeps piling up within the blood. Myopia can also occur from an embryological standpoint in patients with renal coloboma syndrome, and decreased visual acuity due to the effect on the optic nerve is also observed. Some of the signs in the case of renal coloboma syndrome can include hypoplastic kidneys, which is smaller than the average size for the age group, renal hypodysplasia, which is the reduced number of nephrons and disorganized renal tissue within the kidney. And reduced number of nephrons would mean there's a less functional unit for the kidneys to take in blood and filter it with the glomerular structure. And multicystic dysplastic kidneys in 6 to 10% of renal coloboma syndrome. Other signs of renal coloboma syndrome includes the vesicourethral reflux as the post-renal passageway for urine is blocked. And in the eye, dysplasia of the optic nerve can be presented. And as you can see in the middle picture below, there's an enlarged optic disc as well. Coloboma can also present in the retina in addition to the optic nerve. There can be a failure to close the uveal tract during the ophthalmic development, and sadly there would be missing retinal tissues exposing the uveal layer in the nasoventral portion to the incoming light. And rarely, complications can arise within the kidney and the eyes, as well as in other organs. In the eyes, sclerostaphyloma, which is an abnormal protrusion of the uveal tissue through the sclera, can occur, and the optic nerve cyst can be found. Macular abnormalities, including degeneration and hyperpigmentation, can be found, and lens abnormalities, including opacity and posterior subluxation of the lens, can also be found upon examination. In this syndrome, in the ear, there can be instances of hearing loss of higher frequency sounds. The skin can become more soft and prone to bruising and injury, and joints can develop laxity with the ligaments. This can become obvious in physical exams of the limbs. Differential diagnosis includes the CHARGE syndrome, which stands for coloboma in the eye, heart defects, atresia of the choana, which is the posterior portion of the nasal passage. R is for retardation of growth and development, or in more recent terms, growth impairment. And E is for ear abnormalities and deafness. Bronchio-otorenal syndrome is characterized by pits and ear tags in the outer ear, abnormal passages from the throat to the surface of the neck, and branchial cysts. Cat eye syndrome presents with conductive hearing loss and widely spaced eyes known as hypertelorism, and palpebral fissures that are pointed downward from the outside corners, like a cat. The genetic test can simply be from a PAX6 pathogenic variant. Joubert syndrome is characterized by underdevelopment of the cerebellar vermis and also a brain development disorder, and can present with ataxia, apnea, and abnormal eye and tongue movements. CACUT stands for congenital anomalies of kidney and urinary tract. These are just some of the differential diagnoses for someone presenting with renal coloboma syndrome. Investigations of renal coloboma syndrome in the eyes especially includes fundoscopy with attention to the retina, molecular genetic testing with single genes, chromosomal microarray, multi-gene panel, or genomic testing. It could also have a renal ultrasound and urinalysis to assess the functions of the kidneys, and BUN, creatinine, and serum electrolyte is also indicated to assess the renal functions.